today we will learn about blood, which is in chapter 1, in which in this chapter you will cover a topic about the ABO systems, the blood transfusion, rhesus factor, and also disorder or disease that related to the blood. So, in human blood type, there are two most common blood typing that you can find in human, which are referred to the ABO systems and also the rhesus system. For ABO blood group system, this system is classified the human blood based on the inherited properties of the red blood cell only, okay, not including the white blood cell, plasma whatsoever, and it determined by the presence or the absence of antigen A and antigen B. Okay, so different human blood types are due to different variations on the surface of the RBC, which is on the surface of the red blood cells. There are some red blood cells that do have a surface marker, and some of the blood cells do not have the surface marker. So the variation in the surface marker is medically important because the immune system proteins, in which we refer to the antibodies, can recognize and attack on virtually anything that is not similar with the surface marker of the RBC. So any molecules that can trigger the antibodies to have the antibodies as a defensive effect attack is called as the antigen. Okay, so red blood cell be a highly specific surface antigen, which is made up from the glycoprotein, as you can see here, and the presence of the surface antigen closely related with blood typing system, which refer to the ABO system. Okay, so this is the world distributions of blood group type. As Asian, most of us have 39% of Asian have a blood O with positive rhesus. Okay, so with severally mentioned about antigen just now and also antibody. So what is antigen and what is antibody actually? So antigen can be found on the surface of cell to help the immune system to recognize the surface cells itself. Meanwhile, antibody is the one that being secreted by the lymphocyte in response to any foreign cells that could not be recognized by the cell itself. So in ABO system, there are different antigen on the surface of the erythrocytes. For type A has A antigen. Therefore, it does not recognize antigen B, and it can produce antibody B to protect the type A blood. For type B blood has the B antigen on the surface of the cell. Thus, it will produce antibody A when it encounters antigen A on that cells. Okay. Meanwhile, type AB blood that has both of the A and also B antigens. Due to the presence of both A and B antigen, therefore, blood type AB does not produce any antibody, okay, because they recognize both of A and B antigen. Meanwhile, type O has neither A nor B antigen on the surface, meaning to say the surface of the type O red blood cells does not have any surface marker. Okay, therefore it will produce both of antibody A and also antibody B, as it does not recognize any it does because they do not have antigen A and also antigen B. Okay, this is how it looks like. Not really how it looks like. Okay, you can imagine it looks like this. As blood type A, they have a surface marker of antigen A. Meanwhile, blood type B, they have a surface marker of antigen B. And blood type AB, the surface marker consists of antigen A and also antigen B. Meanwhile, blood type O does not have any of the antigen on its surface. Okay, therefore, for type A, since they have antigen A marker, so it will produce antibody B because it does not recognize B in the red blood cells of A. Same with B. Okay, it has antigen B on the surface, and it will produce antibody A. Okay, when they detect any antigen A beside from the cell itself. So for AB, since it recognizes both A and B, it does not produce any antibody. And for type O, it does not have any antigens. Therefore, it will produce both of A and B antibody. So as you can see here, it's the same with the previous one. Next is blood transfusions. So blood transfusion is actually the process of transferring the blood component from one person into another person. So the blood they use in the transfusion must be compatible with the one's blood type, meaning to say the donor blood needs to be compatible with the recipient blood. Okay, and blood transfusion can be life saving because sometimes when there is any accident occur, massive blood will lose, and we need a lot of blood to replace the blood lost during the surgery. And blood transfusion also used to treat severe anemia and also other diseases, blood diseases. Okay, and there are two types of blood transfusion. First, we have whole blood transfusion, and another one is packed red cells infusion. So, whole blood transfusion, based on its name, it is referred to the transfusion of a whole blood in which this whole blood that has not been modified except for the additions of the anticoagulant. Anticoagulant is a substances that help to prevent from the blood become coagulate. Okay, usually such as the heparin and also, if I'm not mistaken, vitamin K. Okay, and whole blood transfusions are routine when blood loss is happen very rapid and substantial. And another type of transfusions is packed red cells infusion. So packed red cells infusion is referred to the whole blood from which most of its plasma has been removed. So you have to remember, blood component consists of three components. We have the plasma, white blood cells with platelets, and also red blood cells. For this one, the plasma has been removed from the blood's component, and basically it only contains the red blood cells, which is used for restoring the oxygen carrying capacity. Okay, this one, how does it look like? Okay, transfusion reactions. So if a person receives a wrong blood types, antibodies of the recipient will bind to the erythrocyte or will bind to the red blood cells of the donor, and it will cause the agglutinations. So agglutination is referred to the recipient antibody that attach to the donor RBC, and it will form a bridge, as you can see here, and it will cause the cell to clump together. Okay, so when there is a lot of red blood cells being clumped together, and it can lead to the blockage of the small blood vessels, because when they are clumping they will produce a bigger molecule and they cannot pass through the small blood cells. And when they cannot pass through the small blood vessels, okay, they will lead quite blockage and also cause the hemolysis to be happen. Okay, so here as you can see here, the donor is blood type A, meanwhile the recipient is blood type B. Therefore it does produce antibody of antigen A that will attach to the antigen A of the recipient, and it will cause the agglutination or the clumping together will occur. Okay, so for hemolytic, hemolytic is a very serious complication that can occur after transfusions of blood, and it occur, of course, as I mentioned earlier, due to the mismatch of the blood type infused. It does not compatible. The recipient and the donor blood type does not compatible to each other. Okay, so the red blood cells that were given in the transfusion will be later destroyed by the patient immune system after the antibody of the blood donor of the blood recipient recognize the antigens of the recipient blood, and it will attack them and it will destroy it. Okay, as it recognizes it as the foreign substances or foreign cells. Okay, this is the same. As you can see here, for this one is referred to no agglutination reaction that occur because the cells is compatible. The red blood cell of the donor and recipient is compatible. Therefore, no agglutination will occur. If the blood of the recipient and donor does not compatible, then agglutination will occur, and at the end it might cause the hemolysis to happen. Okay, so this one is that in refer to the which cells that compatible to each other. So this one is similar as I mentioned earlier. Okay, this one also. Okay, look at this. The recipient blood is O, A, B, and AB. Okay, so this one you have to fill in the table which one is compatible and which one is not compatible with the recipient and also the donor blood. Okay, okay, as you can see here, if the recipient is blood type O, okay, it only can receive a donor with type blood O only. Okay, so if the recipient is blood type A, it only can receive a blood from donor type O and also donor type A. For recipient blood type B, it only can accept the donor with blood type O and also blood type B. Meanwhile, the recipient with blood type AB can receive all types of the blood because they do not have any and they do not produce any antibody on the red blood cells. So this one can be referred as the universal recipient. Meanwhile, blood type O is the universal blood donor. Okay, so this one, as I mentioned earlier, type O blood is universal donor because they can donate their blood to any recipient. Meanwhile, blood type AB is universal recipient because they can accept any blood types in human. Okay, okay. This one is the same. How does the agglutination occur? Okay, during the blood testing. Okay, so if you have type A blood, when you put antibody A and it's clump, so meaning to say it's not it is blood type A. So if you put antibody B on your blood type A and there is no clumping will occur. Okay, this one is the same. Next is referred to the rhesus factor. So what is rhesus factor? So rhesus is the most complex system with over 45 antigen that being discovered in 1940 after work on the rhesus monkey. However, later the same antigen was also discovered in human, in which the rhesus gene located on the short arm of the chromosome 1. Okay, so for rhesus factor, okay, so if our red blood cell carry D antigen, okay, it is known as rhesus positive. If our red blood cell does not carry any D antigen, it's referred to the rhesus negative. Okay, so unlike the ABO system antibodies, anti-RH antibodies are not spontaneously formed in RH negative individuals. Okay, so it meaning to say that RBC, the rhesus positive person, okay, they already form the antibody inside their body. However, for the rhesus, sorry, this one have no an antibody. However, for rhesus RH negative, rhesus negative, it does not has any D antigen, right? Therefore, they will produce antibody for rhesus, okay, for D antigen, and however, it does not produce spontaneously, okay. So when the rhesus negative person, okay, that does not have D antigen, receive rhesus positive blood, the immune system will become synthesized and begin to produce antibody RH, uh, antibody of rhesus, okay, because it does not recognize any D antigen, okay. And you have to know that the D gene is recessive. So if the person, the gene of the person is big letter of T and small capital letter of D and small letter of D, or as long as it does contain capital letter B, so the D gene is dominance over here. Therefore, the person is rhesus positive. Meanwhile, only the person with DD small letter are rhesus negative, meaning to say there is no D antigen on the red blood cells. So these are the distributions of the D antigens in populations of Caucasian, African American, and also Oriental. You can read this one by yourself later. Okay, so look at this. This one, for the person that have a blood positive, rhesus positive, they have antigen D on the surface of the red blood cell. Therefore, there is no antibody will be produced because they recognize the antigen D. Meanwhile, for rhesus negative, they do not have any antigen D on the surface of the red blood cells, and it does produce antibody for rhesus D if they encounter any red blood cell with antigen D. Okay, so what is the significance of rhesus D? So 80% of rhesus negative person exposed to rhesus positive blood will develop antibody, right? So antibody D can also be stimulated by the pregnancy with rhesus plus baby. So let's see. Okay, here how does it look like? Okay, so here, okay, to be easy, let's see on this figure. The father is rhesus positive, meanwhile the mother is rhesus negative. Therefore, when the mother get pregnant, the baby might have rhesus negative or rhesus positive, right? For in this case, the mother pregnant with rhesus positive baby, and this rhesus positive does not compatible with the mother blood, which is rhesus negative. Therefore, okay, the rhesus antigen from the developing can enter the blood mother during delivery. Okay, however, it's safe for the first pregnancy. Okay, but after the mother detect the rhesus positive blood inside the mother body, so the mother will produce antibody D that recognize the antigen D of the baby blood. Okay, and then for the next pregnancy, if the baby, if the mother gets second pregnancy with rhesus positive baby, what will happen then? The antibody of the mother will attack the blood cells of the baby. So it is very dangerous. Okay. Okay. So how does we want to treat this problem? Okay. The treatment is that the mother need to be treated with the raw game before or shortly after giving birth. Okay. So what is raw game? So raw game is actually referred to the serum that containing Rh agglutinins, in which the antibody Rh agglutinins will block the mother immune response and also to prevent the sensitizations of the mother antibody. Okay, this one is also similar. This one also similar. I already mentioned about this one earlier. And next is we go to blood disorder. So there are different types of blood disorder. So the first one, we're gonna look on the anemia. Okay, so anemia is actually referred to the decrease of the decrease in the amount of red blood cells or the amounts of the hemoglobin in the blood. So the blood has abnormally low oxygen carrying capacity, okay, for anemia patients. And the blood oxygen level could not support a normal metabolism of a human, and it will cause the symptoms such as the fatigue, paleness, shortness of the breath, and also the chills for the anemia patient. Okay, and because the reductions in the oxygen carrying capacity of the blood bring to the pale skin, headache, fatigue, and dizziness, this one is actually caused by the low level of the hemoglobin in red blood cells, low number of red blood cells also to carry the oxygen, and abnormal shape, maybe abnormal shapes or abnormal characteristics of the hemoglobin, and also can be caused by the heavy menstrual flow in women. Okay, so as you can see here, anemia patient has more pale skin compared to the non-anemia patient here. And there are different types of anemia. We have iron deficiency anemia, in which refer to insufficient iron result in fewer hemoglobin molecules in red blood cells. And then aplastic anemia is referred to the bone marrow of the bone does not produce enough stem cells to differentiate becoming the red blood cells. And then hemorrhagic anemia is referred to the extreme blood loss during injuries, malaria, or bleeding ulcer. And then next we have pernicious anemia, which is referred to deficiency of vitamin B12 that to be absorbed by the digestive tract. And last but not least is that sickle cell anemia. Sickle cell anemia is a type of disease or a disorder where the red blood cell becomes sickle shaped when the oxygen concentration is low. And this one is an inherited disorder from the family. So as you can see here, aplastic anemia, the bone marrow does not produce enough red blood cells, or less of red blood cell in your bloodstream. And then for this one is actually referred to this one, okay? Pernicious anemia. So in the case of pernicious anemia, okay, the cells does not produce enough vitamin B plus to be absorbed by the intestine, okay. And then for sickle cell anemia, what happened is that for normal person, the red blood cells the shape is very rigid and sticky, like crescent moon, as you can see here. So it can flow very smoothly in the blood vessels. Meanwhile, for sickle cell anemia patient, their red blood cells are very irregular in shape, okay, and sometimes they will clump and later will get stuck in the small blood vessels such as the capillary, which later can cause the slower or the blockage of the blood flow and also the transfer of oxygen to the other parts of the body. Okay, next is for thalassemia. Thalassemia is referred to autosomal recessive blood disease, in which the genetic defect result in the reduced rate synthesis of one of the globin chains that make up the hemoglobin. So meaning to say that when thalassemia patient produce a blood, there is some time where the blood that being produced by the thalassemia patient is not produced very well, okay, is not synthesized and produced very well. So therefore the reductions of the synthesizing of the good hemoglobin will cause the formation abnormal of hemoglobin molecules and thus causing the anemia to occur lah. Okay, as you can see here, this one is the normal red blood cells. This one is blood cell that produced by the thalassemia patient, in which the shape is not irregular shapes and malformed during the productions. Okay, so next is leukemia. So leukemia is a cancer disease that involves white blood cells, in which this group of cancer that begins in the bone marrow and it produces a very high number of abnormal white blood cells. So even though they produce a lot numbers of white blood cell, however, the white blood cell that being produced are in an abnormal state, okay, so it does not functional, and the death usually for leukemia patient is caused by the internal hemorrhage or infection to their own body. Okay, as you can see here, this one is the normal blood. For leukemia patient, they produce a lot of white blood cell, but it become abnormal and malfunction. Okay, this one is referred to the healthy bone marrow, and this one is leukemia. So leukemia, there are two types of leukemia. We have acute leukemia and also chronic leukemia. So leukemia caused by actually the mutation of the white blood cells, caused by the viral infection, exposure to radiation, harmful chemicals, and also genetic factor. Symptoms for leukemia patient is the tissue bruise very easily and the bones become very tender, fragile, and they always got a headache because there is no enough oxygen from that carried by the red blood cell goes to the brain, and then causing the enlarge of the lymph nodes, because lymph nodes is the place where they will store the white blood cells. Okay, so the treatment usually by radiotherapy, chemotherapy, and also transplant of the bone marrow. Okay, this one is how does it look like for leukemia patients. So I think that's all for today class. So you guys already learned about ABO and RESA system, blood transfusion, and also disorder and diseases that caused by the blood. So thank you guys. See you next week.